You're hitting on something that I think is so important, like repeat patients and getting patient retention, making sure patients feel welcomed in this place and stay through anything tumultuous. But also, it prevents complaints. So I was just sitting with a client of mine and we were reading this scathing negative review that came through. And in all honesty, they did one thing wrong. It was one little small aspect that happened after the visit. Didn't even happen during the visit. But on his review, do you know what he comments on? They had a TV in the waiting room that wasn't turned on. And then when I got to my seat, they had it on something that I'm not even interested in. I don't care about painting houses. And so he picked up on little subtle details that then, even though there was nothing inherently wrong in the appointment, when there was a follow-up that occurred that he didn't like, he then uses those lack of customer service details to blast this office. And so it's also providing yourself a little bit of insurance to make sure that you're doing everything in your power to prevent negative reviews, board complaints, even just those upset and angry phone calls that nobody wants to have to deal with. I think if you put the effort in on customer service, you're going to help prevent those things from happening.
We even had a day the other day of surgery cases in our office. I'm looking at the chart review and I'm like, wait a minute, this kid was seen 8 months ago.
Yeah.
So first of all, why are they on my schedule now without having had that? So that's a whole separate issue. But at the end of the day, my point was, what are we doing so that when this kid comes in and if it ends up being more than 3 teeth, which it likely is going to be, at that point, like right after I finished the work, first of all, am I going to get paid? Because this is mom going to be like, I didn't know we were going to need all this work. But that's where it comes in. Like, did I need all this work? Maybe we didn't need all this work. Maybe you just did it because it was, you wanted to bill to my insurance, whatever it is, right? So we want to avoid all of those scenarios. And I think the more detailed you look throughout, that is what builds trust. And it's not easy. It is not easy. Everybody has to be on their A game all the time. I stress that to my team. I'm like, that every patient, every visit, we've got to have those details met.
I agree completely, which is why hopefully full team, you guys are taking notes, even on this first thing that we're going to talk about, which may feel like it's only an administrative thing. And I would say it's primarily administrative, but I want everybody to listen because there's going to be little tips that you can pick up that apply directly to you throughout this patient's appointment.